FORA.tv. The world is thinking.
Here's what we're doing on, and this is fundamental. This is core to what we're doing. When I became Speaker, the first day, the rules of the House that were passed under which we would function said we will pay as we go. No deficit spending. Pay as you go. We made that the rule of the House. It took us until December of '09 to get it to be the law of the land when the Senate finally passed it. But you have to have that discipline. It's something that we progressives have been advocating for 30 years. George Miller had this at the 1982 midterm convention in Philadelphia, and it passed as part of the Democratic platform. Pay as you go. What is this building up deficits, heaping mountains of debt on the next generation? Not a good idea. And the Blue Dogs in our caucus have had this as their mantra and as their organizing principle, and it became the principle for us when we took power, when we gained the majority. So we have that. The president has an executive order on a fiscal commission, which will now begin to meet to address how to reduce the deficit. He has called for a freeze or cuts in all discretionary spending. So there is an urgent need for us to contain the growth of the deficit, and certain things have contributed to it. 2 wars, unpaid for, never paid for, all of it. We'll just go to war and not have a way to pay for that. The tax cuts at the high end in the previous administration have contributed enormously to the deficit. And that's why it was also important for us to pass health care reform, because the biggest increase in the entitlements in Medicare, Medicaid, and that, the biggest increase in the entitlements is the upward spiral of medical cost and prescription drug cost and the rest. So it was, as the president has said, and he says everything so well, but as he has said, healthcare reform is entitlement reform. If we pass the healthcare reform and contain the cost of healthcare, which are essential, the present situation is totally unsustainable. Unsustainable, again, for individuals, for businesses, for the economy, and for the federal budget. So this healthcare reform, if there were no other reason to do it except to contain the rising cost of health insurance and care in our country, that would have been the justification. This bill saves $1.3 trillion. $1.3 trillion because of the bending the curve and taking the cost down and getting rid of waste, fraud, and abuse. $1.3 trillion. But we have to do more so that we can contain but the deficit essential. Our responsibility to our children and not heaping mountains of debt onto them necessitates this. But also, sound fiscal budget policy is important to our economy as well. So there are many reasons why we have to do it, and just, again, the unsustainability of the current system demands that we do it. So by healthcare reform, by pay-as-you-go, by the Healthcare Commission to come up with more ways, and by some of the discretionary spending cuts and freezes that the president is instituting, we're going down that path, but it absolutely must be done.